Okay, good morning to all of my dear viewers. So in today's session, we are going to discuss a very important topics of community medicines, and the name of topic is non-communicable disease. Okay, so what is the meaning of non-communicable disease? Non-communicable disease means the disease which is generally not caused by any infectious agent. Point to be focused. I try to say generally it not caused by any infectious agent. I mean most of the non-communicable disease are not due to the any infectious agents, but in case of cancer, some cancer is develops due to the virus infections like the hepatitis B, hepatitis C. It cause hepatocellular carcinoma, cytomegalovirus virus cause Kaposi sarcoma, HIV infection cause Kaposi sarcoma. So generally, most of the non-communicable disease they are not due to the infectious cause, but in case of cancer, some of the cancer is due to the virus infection or the parasitic infection. So they are the exceptional cause, but generally most of the non-communicable disease are not due to the infectious agents. The another important thing is non-communicable disease are not transmitted from one person to another person by any mode of transmission. So what I am telling to you, the first thing is that the communicable disease is mostly it will not due to the any infectious agent except some cancers, and it is not transmitted from one person to another persons by any mode of transmission. So this is the overall definition of the non-communicable disease. Okay, now what are the risk factor of the non-communicable disease? One of the common risk factor of non-communicable disease is the tobacco smoking. It contribute almost 17% of the lungs cancer. Some other risk factors like unhealthy food, I mean lack of consumption of dietary fibers like no, fruits and vegetables, lack of physical activities, environmental hazards like occupational hazards, air pollution, water pollution. This also contributes in the developments of non-communicable disease, especially the cancers. So after the discussion all about the risk factors, now we moves towards the prevention. So for the prevention of non-communicable disease, WHO launched a WHO Global Action Plans. So according to the WHO Global Action Plans, their first target is to reduce the non-communicable disease by targeting the behaviors risk factors like cessation of smoking, cessation of harmful use of alcohols. Now promote the physical activities, promote the consumption of dietary fibers. So first they try to focus on behavior activities, and by promoting the physical activities and oh, sorry. Okay. Okay, so by promoting the physical activities and promoting the consumption of dietary fibers, cessation of alcohols, smoking. So these are the behavior changes. They first focus to change their behaviors. After that, they also they form some guidelines like reduction of reduction of mortality due to the cardiovascular disease, cancers, and respiratory infection, diabetes. So they try to reduce 25% premature mortality due to cardiovascular disease, cancers, and diabetes mellitus, and the 10% reduction of prevalence due to lack of physical activities, 10% reduction of prevalence due to unhealthy consumption food, 25% reduction of prevalence due to the hypertension, 30% reduction of prevalence due to the high salt intakes, or we can say that more than 5 gram per day. So these all are the target of WHO Global Action Plans. Okay, so what are the different risk factor? I already discussed that tobacco 71% contributes in lungs cancer, insufficient physical activities, harmful use of alcohols, unhealthy diets, obesity, cancer associated infections like the hepatitis B virus, C virus, HIV, cytomegalovirus, Burkitt lymphoma, environmental factors like the occupational hazard, air pollution, water pollution. So these all are these all over the risk factor of developments of non-communicable disease. Now for the prevention, WHO launched the WHO Global Action Plans. They reduce the behavior risk factors like tobacco, smoking, unhealthy diets, lack of physical activities, harmful use of alcohols. 25% reduction of the premature mortality due to the cardiovascular disease, cancer, respiratory disease and the diabetes. 10% reduction of the harmful use of alcohol, and also the 10% reduction of the prevalence due to the lack of physical activities. 13% reduction of the disease in mean population due to the high salt intake greater than 5 gram per day. 25% reduction of prevalence due to the hypertension, and it is ensured that at least 15% eligible people easily access the treatments. So this is all about the WHO Global Action Plan. Welcome back in new session.